Hi, my name is Maggie Rezende, and I am an international board certified lactation consultant. We're going to cover topics such as how to stimulate your milk supply, how often to pump, the different types of pumps, do's and don'ts about pumping. You want to pump, okay, about 100 to 120 minutes a day. Now, at first, it's very difficult to put a pump on this plastic cones on your breast and think that milk is just gonna flow, okay? Sometimes your body doesn't know how to react to that plastic that you just put on your breast. So just little by little, be very patient with yourself, with your body, okay? And start pumping 2-3 minutes. And then in a little while, another 2-3 minutes, okay? You can accumulate those 120 minutes in little minutes or longer times. And maybe as your breasts start getting used to the pumping situation, you may be able to pump for 15-20 minutes at a time, maybe even longer, okay? So the key is frequent pumping throughout the day. Now, make sure that you do pump between midnight and 6 a.m. at least one time, okay? That long stretch, at least one time of relieving your breast of milk. Let me backtrack for a second. The way the breasts make milk is as they get empty, they refill. So the more you empty, the more they refill, okay? Now, you wanna make sure that you're using the proper sizing of the flange. Most pumps will come with some diagram to show you if the pump is fitting you properly. Make sure that your nipples are the only thing that's going into the flange and that your nipples are able to freely move back and forth, that they're not getting pinched or squeezed by that flange, okay? That's very important on the fitting of the pump. As far as pumps, there's a variety of different pumps. If you're in the hospital, ask for a hospital grade pump, okay? Then you have, there's a lot of different companies. I can name you Medela and Amida and Spectra and Buddha, and there's different. You want a strong pump, okay? So hospital grade pumps are usually the strongest, but they vary person by person. My pain tolerance and what I find strong may be different than what somebody else finds strong. And also remember, as you start pumping, the more you pump, the higher you'll be able to take that suction, okay? Read the instructions on the pump manuals as well, okay? Every pump is a little different, okay? I'm not gonna go over all the different instructions to the different pumps, but know that please read your manuals before you start pumping, or YouTube or something on how to use your pump, okay? Now, when you're pumping, something else you can do is if you're in the hospital and you're able to be with your baby, if you're able to touch your baby, look at your baby, just make sure you take a deep breath and just focus on what you're doing on the pumping at the moment, okay? Now, if you're home and you're pumping, go ahead and relax. Sit back, put on a TV show for 15 minutes and just pump. Don't focus on the milk coming out and the pressure of is there milk coming out and how much milk is coming out and not enough is coming out and when is it coming out and why is it not coming out. I'd rather you either cover the pump so you don't see what's coming out or put socks on the bottles so you don't know what's coming out. As you're pumping, you may have several letdowns, okay? So a letdown is when the milk is being released. Hormones are triggered, the milk releases, okay? most of the time, a mom may have 3 to 4 letdowns per feeding session, okay? In the pump, you may or may not see the same. Just continue pumping, okay? Even if you don't see anything. I didn't see any milk coming out for a really long time, okay? And it would take me a week to fill up 1 5-ounce bottle after pumping and pumping and pumping and pumping, okay? 1 week to fill 1 bottle. All you can do is keep pumping, okay? Once you are able to put your baby to the breast, then skin to skin is the best thing that you could do. So you start just putting the baby skin to skin. And if the baby gears towards the breast, he or she may start suckling, may start licking. It's okay. It's okay. Just get them on the breast, okay? If they suckle, they may suckle and stop. This is just something that is going to take some time, okay? It is a learning process for both you and the baby. So once you do get that baby on the breast and you are able to get that skin to skin, I suggest make sure you have some privacy, that you're comfortable, that you're relaxed with your baby, whether that's at the hospital setting or whether that's once you get home, okay? As far as how to increase your supply, some babies are born, you know, at 24 weeks or earlier or later, depending on where you are in your pregnancy. Milk is usually produced by the 3rd trimester, okay? What you want to do is you can look up galactagogues, which are things that people say make milk, okay? There's a lot of stuff out there. I've learned through all these years, a lot of it is cultural. Every culture has what they think makes milk. As long as it's not hurting you, I tell all my clients, just try it. Try it. It doesn't hurt to try. As long as it's not hurting your supply, and if you think it works, it will work. I remember I would take everything that anybody would suggest to me because I just wanted a supply. Whether it did it or not, it didn't matter to me. I was gonna try it, okay? I like hot teas and hot soups. So a great thing to do is when you're about to pump, maybe have some tea right before, take a hot shower, or have some hot soup. It doesn't make you milk, but it helps release the milk, okay? So that's something that I suggest. And as far as what you take, things that people suggest, once again, make sure it's safe, that it's not gonna be harmful, okay? Because these babies, some of them being so small, they may be very sensitive to some stronger herbs that some other mom may be suggesting for their, you know, full-term healthy baby, okay? So just make sure that you either reach out to myself or ask the lactation consultants in the NICUs to see if they believe it's safe for your baby, okay? As far as storing your milk is good out in the open for 4 to 6 hours. The quicker you get it to the fridge, the better. The quicker you get it to the freezer, the better. It's good in the fridge, you know, 5 to 7 days. We usually say 5 days. By 5 days, whatever you haven't used, put it in the freezer, and then it'll stay good for a while, okay? In the freezer, about 6 to 12 months. Something else is once the milk is thawed out, you do have 24 hours to use it. Once the milk is completely thawed out, no ice crystals in the bag, then you have 24 hours to use it, okay? Something else that we like to cover is the plugged ducts, the mastitis, the infections that can occur. Usually when they do is because milk is backing up, okay, and the milk is not being released. Just make sure that you are pumping frequently, okay, even if it's a few minutes, okay? And that if you run into that situation where you feel some lumps or anything on your breast, once again, reach out to someone, but you can always apply heat for 5 minutes to kind of loosen that up, and then start your pumping session. That's just milk not being drained out, okay? So milk starts backing up, and it usually happens where you kind of see it coming. You'll start noticing some fullness, you'll start noticing some redness, you may palpitate and feel lumps. So just make sure that you are draining the breast properly, okay, once the milk is coming in. It has been a pleasure to be able to speak to you about some of these topics